Okay.
Watching my uncle lay in a hospital bed was one of the most horrible things that I've ever had to witness. He began smoking when he was a teenager, and because of his bad smoking habits that he picked up at an early age, it began to take a toll on his heart, and he had to have triple bypass surgery. Smoking has become a popular thing, not only for people that are of age, which is 19 here in Alabama, but also for people who are under the age of 19. I'm not going to disclose what my age is, but I will say that it's imperative that we don't begin to start smoking if we haven't been smoking, and that if we are smoking, it's imperative that we try not to smoke. The risks of smoking are greater than the benefits. Smoking is the most common cause of lung cancer. Smoking is also the leading cause of cancer of the mouth, cancer of the throat, and cancer of the bladder and the kidney. Smoking not only affects your inside, but it also affects your outside. It can cause your teeth to change shades. I know everybody wants their teeth to be pearly white. You can make them be nice and yellow. And smoking also dries out your skin, and it'll cause premature wrinkles. Now that we see the extent of the problem of smoking, we're going to take a look at what may be some of the causes of underage smoking. 3 probable causes of smoking with underage teens are, the first one is peer pressure, the second one is some teens believe that smoking helps with stress, and another cause is that some students say that smoking increases academic performance in school. Peer pressure is probably the most major and common cause of underage smoking. Oftentimes, teenagers want to be cool and be like everyone else when they might begin smoking, and a lot of times they really don't know the risks that go along with smoking, so they engage in that activity. Some students that think that smoking helps with stress may use it because of situations that they have at home or situations going on at school. Maybe they have a full course load, things of that nature. Now that we've discussed some of the causes of smoking, we're going to talk about what we can do to help the growing epidemic of underage smoking. 3 major steps that we can take in order to solve the problem of underage smoking. One thing that we can do is take time to talk to the youth. You can volunteer at a local school. I'm sure they'll be glad to have you. And talk to them about smoking. Also, if you have children of your own, you can start at an early age and start talking to them about smoking versus waiting until they get in high school and they're already engaging in those activities to try and make them stop. It'll be better to be proactive and try to prevent it. As a country, we can vote to have stricter laws in place for people who sell tobacco to minors, because you have to wonder where these teenagers are getting the cigarettes from. Yeah, sometimes parents do buy them for it, but most of the time there are teenagers who can go into the store and they can just buy it on their own, having no ID check, or having their ID check but not looking close enough to see that this is not the person's ID. Another thing that can be done as adults is maybe create programs where high school students can talk to younger grade school students about how it's cool to be smoke-free, because the major problem with underage smoking is peer pressure. Maybe if we get some older kids who they view as cool and they're not smoking, maybe then, they'll not want to smoke. Smoking causes more deaths per year than deaths by car crashes, HIV, drug use, alcohol suicides, and murders combined. Although it seems impossible, we as adults can make a change in children's lives. Does anyone know how many bricks it took to finish building the largest building in the country? It only took one. It only takes 1 brick to finish. So maybe we can be that one adult that can change the lives of our youth. My name is Annette, and that is my presentation. Thank you.